Good morning.
Hmm, hmm, Testing, testing. Oh, I get you.
Good morning. We welcome you to the Voice of Biblical Fundamentalism, a 4-hour program of the Refuge Baptist Church, situated behind the medical dormitory in the Catholic Hospital community in the oldest Congo town. This morning, our focus shall be on COVID-19 pandemic, as COVID-19 claims tens of thousands of lives and many hundred thousands more are infected. One way of wondering as to what is the relationship of this deadly disease to the sovereign God. If God is aware of it, why is he not intervening to save his children's lives? Is he still in control of the universe? If he still possesses the power that he demonstrated in the Bible, what might be the reason or his purpose for standing by as evil men cause such disease to inflict havoc on people? How can one tell that he has the disease? How is the COVID-19 compared and contrasted with Ebola? What should be the biblical attitude to adopt as Christians? For the answer of these questions, I have invited the following doctors and medical practitioners from our church, the Refuge Baptist Church, to discuss the COVID-19, the Christian worldview. With me this morning in studio, I have on my right hand
Mrs. Kerkulah.
and on my left.
Mrs. Vicky Fayasem.
Today I will be your moderator. Pastor St. Solomon Joa will not be with us as he's attending to national duty at the National Broadcasting Station. So my two doctors are here with me that we discuss the COVID-19. But just before we go into our discussion, we want to register our sympathy to some of our brethren that have lost loved one, not actually to COVID-19. They died during the past week. To the Kokans, they lost their brother, the younger one. And to the gays, the family of which I am, they also lost their aunt. We pray that God console you as you mourn your loved ones. So doctors or health practitioner, welcome in studio. As
Thank
we're
you.
discussing, there are a few questions we will be considering. So these questions will be posted and we'll have your view on them. We'll begin with Dr. Sam. How did this virus come about and where? The COVID-19 virus.
So I will say good morning to our listeners and our viewers. I want to be thankful to the Refuge Baptist Church and our pastor, Pastor St. Solomon Joa, for giving me the opportunity to be here today on this broadcast. So the COVID-19 virus It started from Wuhan, China, that is in December of 2019. And in China, China is one of the countries where people, they usually eat so different kinds of animals, and then they started noticing some symptoms. And after some time, it did spread in the entire China from that Wuhan area.
Okay, thank you, Dr. Sam.
Strain, the COVID-19 is a strain of coronavirus, and it was first identified in China, to be specific in the Hubei province. Going to understand fully the source of the disease, but it is said that it came from animal. So the basic thing to know is that COVID-19 is a strain of the coronavirus that has been existing long time ago.
Okay, we will remain with you, Madam Kerkulah. Is this a natural or ordinary virus or man-made?
I cannot say it's not a man-made, because most times when we talk about viruses, they are usually from natural sources. So to come out and say COVID is a man-made, I have no scientific backing, no scientific proof. I would say COVID-19 is a virus like we have other viruses around in the world.
Dr. Sam, do you want to speak to that? Any addition?
Like she rightly said, COVID-19 or viruses, they are natural. It is not man-made. Just a large family of viruses, except for that of the coronaviruses.
How is the virus passed from one person to another?
So usually COVID-19 is passed from one person to another by droplets. Usually if an infected person coughs, sneezes, or exhale, that is when speaking or even from that of his nostril, you notice that those droplets are sprayed in the air, and then they fall on surfaces. And then, for example, if you are standing less than 1 meter from that person that is infected, just sneeze or cough, you will definitely inhale the droplets, thereby getting the virus into your system. And for those droplets that fell on the surfaces, the hands would usually touch surfaces. So when the hands are infected, it's also possible for you to touch your eyes, your nose, or your mouth. So therefore, we advise our patients not to shake hands, not to get close to people you observe the 1 meter distance, that is about 3 feet away from an infected or anybody that is coughing or sneezing. And then you wash your hands continuously, and then observe the social distancing. And by practicing right hygiene, that is respiratory hygiene, by you can do a cough or sneeze in the elbow, that is a bent elbow, thereby preventing the spread.
Okay, Madam Kerkulah, I seem to be confused when Dr. Sam said that by touching the eyes, the mouth, or the nose, the virus could spread. But my confusion is on the eye. How is the virus transmitted? I mean, by the eyes, by the human eyes.
Yes, that the same spoke concerning the droplets, the virus will be spread by airborne droplets. So if a person is infected and the person sneezes or cough without covering their nose or their mouth, another person who is close range, who will say the usual range for social distancing should be 6 feet away, and the person is not 6 feet away, the virus will get into the eyes, the nose, or the nostrils, or the ears. Usually, virus look for what we call the pink spot. Our eyes have soft tissues. The pink spot, you see, if you turn your eye, you look to the lower lane of your eye or to your conjunctiva, you will see a pink. And the virus need to survive. They are looking for a place that they can survive. So they will get to where we commonly call the pink spot in the tissues of the eye and find its way into the bloodstream. If it goes into the nose, the pink spot is in our nose also. They seem like our mouth and our ears. So where the pink spots are, they find their way and they enter the body system and try to multiply and take over. So that's why it is advised to keep away from someone who is symptomatic. It means someone who is coughing or sneezing. We should stay away from them.
Thank you, Madam Kerkulah. Dr. Sam, you talk about droplets. Uh, uh, could it also be spread by maybe bodily fluid like sweat or other perspiration, something like that? That if you come in close contact or close proximity where maybe your hand touches someone that is sweating, could the virus also?
Well, for now, up to date, according to WHO, for now we do not have the virus being transmitted by bodily sweat or bodily fluids, apart from those droplets that comes from that of the respiratory tract. If it's on the person, for example, on the person's hands, and then you touch it, that's the only way. But not from sweat, not from any other bodily fluid for now as of date, WHO. So, but other studies are all it's on the way going right now. So maybe later will be updated.
So apart from the soft spot, as Madam Kerkulah spoke on, the human skin, could it also permit the transfer of the virus?
I would say no to that. So mostly the places that
because the skin has some pores.
They have some pores, but mostly the places that the virus will easily be transmitted is the mucous membrane. Those are very thin layer membrane. For us, the skin is a real protective barrier, although they are pores, but the virus is not transmitted.
Thank you. Pores. Okay, our next question. What part of the body is the target of the COVID-19? I think you spoke largely on it, but could you go over that?
So we say the respiratory tract, because COVID-19 is a respiratory illness. So we have from our nose, our mouth, and then it goes down your entire esophagus, all the way to the lungs, your entire respiratory system. So mostly you will notice that if there is any infection in the lungs, the patient start to sneeze, and then they will be able to cough and all that.
Madam Kerkulah, how can one tell that he has been infected with this virus, the COVID-19 virus? How can a person tell?
Firstly, the person should have history of exposure. So if the person have history of exposure, and then within 2 to 14 days, when they start to experience fever, cough, sneezing, weakness, and so on, these are the basic signs of somebody who has been infected with COVID-19. So anybody who has traveled to a place that is exposed or is an COVID-19 endemic, when they come from that place and starts to experience these signs, then they should be thinking on COVID-19. That's why you see when people travel from outside Liberia, from those countries that are reporting cases of COVID-19, they are basically under precautionary observation for 14 days until they are proven to have no signs of COVID-19.
So that the same, what could be your advice to an individual having those symptoms or maybe experiencing?
So for an individual experiencing those symptoms, we say you have to go to a health facility where you will be tested. Before being tested, before even going to the facility, you will have to wear a mask if you are having those symptoms, especially for the coughing and the sneezing, because you do not want to transmit the virus to another person. So you will put on a mask and then go for testing. And after that test, whether you are positive or negative, then the treatment starts.
What is the best method for saving oneself from this virus? Is there
So for saving yourself from COVID-19, the first thing is regular hand washing. So you wash your hands with soap and water or with alcohol-based rub that you have to clean your hands with regularly and thoroughly, not just putting the water and then making the hand soak, but by washing it. Another thing you also want to do is the social distancing we mentioned. You have to keep away at least 1 to 2 meters away from a person that is sneezing or a person that is coughing. Another thing you also want to do is to practice what we call a good respiratory hygiene, where you have, whenever you want to sneeze or cough, you will bend your elbow and then sneeze into your bent elbow. Another thing you also do in order to avoid contacting the virus is for you to get more information about the virus and then get it from the real sources where you will be updated, and then that helps you with the knowledge in order for you to prevent the identical virus. Another thing is the reason we say the hand washing, you touch surfaces all around the place. It's possible to transmit the virus to your eyes, your ears, and then none of your nose. So those are some of the things.
Madam Kerkulah, any addition?
Yeah, Dr. Say has said a lot concerning the question. But I would say it is good to stay away from people when you know you are experiencing these symptoms. If you are with your family in the home, you have to stay away from your children, your husband, and other relatives in the house while you seek help. And the number is active from the Ministry of Health and Infield. You call the 4455 and then they will come to your house to pick you up. But to keep yourself safe, the good thing about COVID-19 is that there are preventive measures. So you need to wash your hands regularly with soap and clean water. And then if you don't have water around you, you use the alcohol 70% to rub your hands and ensure that you don't touch surfaces around you often, because you don't know whether the virus, somebody has sneezed or coughed around the area you are. So you need to keep yourself away, your hands away from surfaces. But if you have to touch surfaces, then you have to wash your hands with soap and clean water. So that's what I can say concerning some preventive measures.
How may COVID-19 be compare or contrasted with the Ebola virus?
Yes, there are differences, there are comparison. First, let me start with a comparison. Ebola is a virus disease. COVID-19 is a virus disease. And Ebola affects human, COVID-19 affects human. So to contrast the both sicknesses, COVID-19 is a respiratory disease, and Ebola is a gastrointestinal disease. So that's the difference. And another thing is that the speed at which Ebola spreads is completely different. The mode of transmission for Ebola is completely different as compared to COVID-19. COVID-19 is spread by droplets, and we know that Ebola was by touch. And now we see Ebola was just limited to Africa. It was an epidemic, but COVID-19 has been declared as pandemic. So that's the comparison and the contrast of the both sicknesses.
Dr. Sam, any addition?
Yeah, actually, it is Kerkulah have already said the major ones. And just remember that Ebola, usually you have to touch, especially it was transmitted through bodily fluids. So you had to actually touch a person before. But now, for COVID, you have to inhale. And that's the thing. So we have to be careful.
So comparing the two, could we, looking at the rate at which it is transmitted, looking at the effect on the human body, could we weigh them on a balance to see that the COVID is more, desperate or dangerous as compared to Ebola? Is it?
Yeah,
Could we
for
have
me, I
some
think,
some skill like that?
yeah, for me, I think so that COVID-19 is, it will actually spread rapidly if caution or the precautionary measures are not put into place as compared to Ebola. Ebola you have to touch. For COVID-19 you don't have to touch. I can be far from you, but still because the droplets in the air and I'm not covering I have no protection or I'm not far from you, I'm able to inhale it as compared to Ebola. So for me, I will put COVID-19 above Ebola.
What about you, Madam Kerkulah?
I will do the same, like she said. I will put COVID-19 above Ebola because of the speed at which the virus is. We saw Ebola in the past, and now we are watching what COVID is doing. COVID has spread to more than 200 plus countries, and Ebola was only limited to our region. So looking at the two speed and the characteristics of the virus, I will put COVID-19 above Ebola.
But what about the days one have to stay in quarantine when he's infected with this virus? In comparison, are they the same time or?
No, for COVID, you see, you have to stay away for 14 days, unlike Ebola, 21 days. So it is not just the incubation period, but we're looking at how virulent it is. That's what we are looking at. Though Ebola will take longer incubation and COVID has a shorter incubation, but the COVID-19 virus spreads so wild, and then the mode of transmission. Brother Abby, it is common that somebody will sneeze around you and somebody will cough, and you cannot stop your breath. You are breathing in and out, and the virus is looking for the pink spot. The pink spot is in your nostril. The pink spot is in your eye. So wherever the virus finds itself, it run right away into the respiratory tract, which is a very suitable place that it will survive to multiply.
How do we view the attitude of Liberians in this COVID with regards to this COVID-19? What what are Liberians doing? Are they doing well? Are they responding? Are they taking advice?
Yeah, for my public health view and public health assessment of the recent things that are unfolding, I see some Liberians emphasizing on misinformation, on myth that is taking away the facts concerning COVID-19. We saw initially when the virus was still in China and Europe. I listened so many times to the question and answer time on BBC at 4 p.m. And some Africans were saying the climate is so hot, the weather is hot. In fact, because our skin is black, we cannot catch COVID-19. But then it's proven to be false. And because of all these things, some people are not taking the preventive measures serious. They are taking it for a joke. They are not even obeying the social distancing rules or principles that we have to follow during these times. So many things are happening in Liberia. Though the Ministry of Health, the MPhil, and the government is doing all they can to inform Liberians on a daily basis through different mediums. Of recent, I think you saw the communicators, what we call volunteers, going around carrying on the basic messages. But people will just laugh and they will not be taking it serious. But we are not surprised because it happened here during the Ebola epidemic. So we are not surprised when we see Liberians behaving this way. But equally so, we still have the right and we should be informing them and keep reminding them that this is a real situation. It's nothing about friction. It's nothing about faking or making a story. It's real. So we need to keep emphasizing it and reminding people to follow the preventive measures.
Dr. Sam, what would be your advice in that line?
Yeah, so I think that Liberians is like overlooking the entire COVID-19 virus. Some are saying that it's just a political thing. The government wants to eat some of the money, and then this thing is not real. But you know, in Italy, when it started, when they had their 5 cases, that was the same attitude people had. They had messages going around, but people were not heeding to the precautionary measures like that of Liberians now. You walk in the street, you see people, they are crowded up. Right now the gas issue, but you go to the gas station, you see people so crowded. The place is so crowded up that they're not even maintaining that social distancing that we are even telling them. But what I have to say is that COVID-19 is real. It kills. So we have to take all the preventive measures, especially for Liberia, where we do not have all the life support that will help us, the instruments that will help us to be able to save a life, especially when it reaches the point where the person is severely ill to the fact that you're having respiratory difficulty. And we cannot do anything about it in Liberia. So for us, the main thing is to take precautions.
Are we relaxed?
Yeah, for
Is
me,
it
I
that
think we are relaxed. We are actually relaxed.
Madam Kerkulah, is it that the people they are not getting the message, or what could be responsible for this?
Several factors interplay. One is that we are not seeing so many persons sick and dying. The next one could be that we feel that because of the same misinformation and myth, we feel that our skin color and our temperature here will not permit the virus to come into our country or to remain here for a longer time. So there are several factors. So because of these things, people are so relaxed and feel that it is not important now and we are stronger than the whites. That's why I hear people often saying we are stronger than the whites because we are black and we are being exposed to so many respiratory tract diseases. So our respiratory system is so stronger than the white. So many things are interplaying. So therefore, people are not taking the COVID-19 as serious as it should be, looking at what is unfolding in other countries around the world.
So when you talk about social distancing and looking at the marketplaces, looking at other places, how do we actually effect those measures?
Yeah, of recent, we saw I think a week ago, we saw the standing order from the Ministry of Health emphasizing on people not selling on the street and the marketplaces. And then they said they were going to come up with special policy regarding how the market will run, whether they will be selling by days, and what they will put in place that will keep people safe, people that are in the market and people that will be going to the market. So looking at the market will be a specific strategy that will be put in place, especially now that we have minimum cases. We need to have a strong policy that will be enforced, not policy that will just be documented, but policy that will be enforced, that Liberians will know that it is serious and that social distancing is essential. I feel maybe there will be a time that this market will have opening times and that regulations will be, people will be regulated how to access the market. I feel that there will be a time because we see similar things happening in countries where the grocery shops are open according to schedule and people are monitor or guarded how they will enter in. I feel it will happen if for any reason our cases go up, we have to follow these things. We are part of the global community, and whatever is taking place in other parts of the world, we need to follow suit to save our country.
Yeah, considering our capacity, are those measures possible? Could we restrict people like those our marketplaces are open market apart from the supermarket? Could it actually be possible that people be restricted as to when to go, how close to get to the person you want to buy from? Are these things possible in our setting?
Yeah, I would say, brother, I mean, they are possible because even the mind, the human mind, God forbid, if you have so many cases, people going to the market will think, they will be thinking about themselves and they'll be thinking about others. So if you have so many cases like other countries have, you'll be very careful, you'll be afraid. And people will try to stockpile the minimum they can pack in their homes. And people will see that going to the market often will be a risk for them. So people will try to conduct themselves. When the time will reach at that point, automatically will do as others are doing. So it is possible.
Yeah, that's the same. Now the fear factor, considering Ebola, how it was being maintained and how people, I mean, respond. Do you think if, God forbid, as we said, do you think similar fear could engulf the Liberian populace that they will take heed to those measures?
Yes, I think when we have more cases and then when Liberians are hearing about death and all that, yes, because the fact of the matter that we only have about 3 cases and then from yesterday we have another suspect case in Grand County. People are just taking the thing like it doesn't exist. They'll put just doing all kind of thing. But I would say that when there is information or there is increase in the number of cases, we will get serious and then there will be fear. Fear will grab people all around Liberia and then they will try to put in those measures that will save them and their families.
Okay. Why must Liberians focus more on prevention of COVID-19? Why do you think we should focus on prevention rather than curing the disease?
So as we know, prevention is better than cure. So as for us Liberians, if we look at the statistics, looking at those countries around the world that are, I would say, well developed, have their health system is well built and structured. They have all the basic facilities for life support. And then comparing it with Liberia, if their cases can be increasing and then they have deaths, high rate, when you look at the statistics, the deaths, that is not easy. So if they can be having low number of deaths as compared to Liberia, who is this country that is underdeveloped, and then our health system here, we are still struggling to build our health system. If we do not take precautionary measures now, and if it gets out of hand, we won't be able to control it. We do not have ventilators, we do not have any other those sophisticated materials that we need to be able to control the virus.
Yes, Madam Kerkulah, do you want to speak to that and also speak to that new wall ventilator? I don't know what is it used for. What is it? Something like ordinary vent or other things? Or how?
Yeah, Dr. Sim has spoken the basic about the capacity, the national capacity. Our capacity is minimal, and we all know it as Liberians. We don't even have the space if the outbreak gets bigger. We don't have the space for hundreds of people. The next thing, because of the outbreak, the basic health services will collapse. So other illnesses will be left untreated. As for ventilators, we mean ventilators are respiratory assistant. To be simple, they are machines that serve as respiratory support for the human body. So when you see the people lying down in critical conditions, where we say that lungs is failing. They have fibrosis of the lungs is impaired. They need the assistant respiration. So therefore, these ventilators serve as assistant respirator. But it is costly. That's why laboratory should now focus on prevention. One of these machines costs up to 50,000 United States dollar. Very costly, very expensive. And now we see this epidemic. We now have external support as in the case of Ebola. The countries we are depending on to help us if we go themselves are fighting. So therefore, librarians should focus on prevention rather than allowing a bigger outbreak. That's what I can say.
Our preparedness, our capacity, and our concentration as a nation. How prepared are we? And how have we prepared for this COVID-19?
Well, as I said earlier on, I'm speaking as a public health specialist. I'm not speaking for the government of Liberia. I'm just speaking my capacity as a public health specialist in Liberia. And I have been following the preparedness component, and now I'm following the response. And for preparedness, the little that the government could have done, the government did it. The government set up measures. You know, when it comes to pandemic diseases, surveillance is key. Your ability to detect the virus earlier save you a lot. So government have so many people, persons that across the counties are surveillance officers before Corona days in place. So they had a county surveillance officer, district surveillance officer, according to the structure of the health system. So they have been working overtime. And you saw at Rawafi International and other posts of entry, they have people posted there, joint security, they have the surveillance officer. And it is because of the surveillance system, you see, they are trying to track and to detect illnesses. And the surveillance system is also at the facility, the health facilities, the primary health facility, at our tertiary hospital, GFK, and so. So the government has these things in place. And for response, our national effort, and the government, the president is supporting. That's why you see initially, before we had the outbreak, he set up the advisory committee, of which he's heading. So he's concerned, and this advisory committee briefed the government, the president, on a daily basis. So at every briefing, there is an action that is taken. So I say the government is doing all they can because they know the impact of COVID-19.
Thank you. Dr. Sam, do you have anything to say on that note?
Yeah, I would say our government and that of the entire health the entire health system is actually doing well from the national public health level, our ministry and that of the government of Liberia. They are putting in measures. We have jingles on the radio for informing people. We have volunteers going communities, and then aiming for that the surveillance that is also going on, the contact tracing and all that. They are actually doing well.
Was the president's song a kind of good message, or was it something political?
No,
Yeah, let's sidetrack.
No, it was actually a good message, especially from the beginning initially. As soon as the outbreak, before we had the outbreak, he had to set up that committee. That was good. It wasn't political.
Did you listen to the president's song? Should the president be singing? I mean, is it a good
you
habit?
don't want his song?
Yes.
I don't know. I haven't really listened to the song, although I've been seeing the messages on my phone, on Facebook or whatever. But normally, I don't think it was a good one for him, because as a president, we have other people that can do singing. We have musicians here. If we are going to let them then do that, but with maybe Jeff's talking in of song and telling Liberians to take the precautionary measures, that's a good one.
Madam Kerkulah, what's your take on that?
I have a different view from Dr. Sam.
Uh-huh.
My view is that having a song sang by a high level person is very important because people love music, especially music from the president, and the music carrying keywords that people will like to listen to. And hearing a song from your president makes you feel that if first it has a psychological impact,
Okay.
and then second it move you to take action.
All right.
And you will say, my president says sing it, and I mean it's very serious. That he had to join
Now,
the musician.
comparing the song to maybe a message from the president, I mean, which one will resonate? Which one will ring bell in our ears? I
Yeah,
mean,
the president has done it two ways.
okay.
Yeah, he gives his every now and then he says basic messages
Mm-hmm.
that Liberians need to follow. He come up with policy decisions by using by asking the Ministry of Health to come up with standing operation procedures. And he has done a lot. He's still doing a lot. So the some part of it is the psychological part of the effort, and it move the population. It make people excited. It make people to listen. You know, people love music, and then they will understand sometimes easier when it comes to music. And he's not singing alone. He's singing with other musicians, but he's singing to as a president, but not just as a president, but as a chief mobilizer for the republic.
Amen. Okay. Carefully observing Liberians, do we stand a chance? I mean that this virus thing could not spread further, could not, the outbreak could not be that huge comparing to other what we're seeing from Italy, what we saw from China and maybe Spain. Do we stand a chance?
Oh, if we stand a chance, provided if we follow the preventive measures. Because science have up to today, science have not proven that because we are black skinned people or because of immunity, that's why we cannot come down with corona. Science have not proven it. So if we decide as a country to follow the preventive measures, then we stand a chance of the disease not spreading. But if we overlook it, and like we saw a few weeks ago when America said the 15 will come to zero, 15 cases will come to zero,
Mm-hmm.
and now we see them to 100,000 plus.
Mm-hmm.
We listen, we saw it. They said 15 will come to zero, and then they went to 100,000 plus. So if we say because we are black skinned people and we do have the humidity is high and the virus will not stay long here, then we'll be making a bigger mistake. Because when you're talking about humidity or temperature, you should be it restricts you straight to surface transmission.
Mm-hmm.
And we are not basically emphasizing on surface transmission. Even though we know that the disease can be transferred if somebody droplets fall on the surface and we touch it and touch our pink spot. But the human to human transmission, that's what we see going on in the world. Human to human. So if we are not robust to have early case detection, contact tracing very active, and we mess up, we can be like the countries around or we are not different from them.
Dr. Kerkulah, what's your take on that? Do we stand a chance? Is the message being put forth? Are we responding?
As we said earlier on, we are not actually responding. The messages they are being put forth all over, but we are not still responding. But we stand a chance if and only if we take the precautionary measures. If we do not, it will actually spread, and then there will be increasing the number of cases, and then this thing will get out of here.
What basic mindset do we need to alter, or what should we stop now for to stop? I mean, in our attitude, in our mindset, what should we stop now to prevent this thing being spread further?
So the basic mindset is that for us, whenever you see anybody, whether the patient, that person is showing some symptoms, whether they're sneezing or coughing, just have it in your mind this identical person will be a suspect case. That one thing you should know. It's possible the person already have the infection. So therefore, I should be very careful with any other person. It can be who, for that matter, from the highest to the lowest. Know that take every individual as a suspect case. And by that, you will always take the precautionary measures. If you just overlook that and say, oh, because this person, it looks good, it's not seasoning and all that, let me go and hug him, let me do this and all that. At the end of the day, we'll be we might be transmitting the disease one way or the other.
Madam Kerkulah, do you want to speak to that?
Yeah, I just want to say little about it. The first thing we should know that our way of life has changed. The Director General for WHO International, he's always saying it, Tedros. He says that we should know our way of life has changed because of this pandemic. So therefore, we need to adapt to the preventive measures. He says that you see your children are not even in school, which is strange. You see that you have to distance yourself from people, which is not common.
Mhm.
So all these things is happening because of this pandemic. So therefore, we need to follow the preventive measures and always keep a positive mindset that when anyone around us is sneezing, as the same said, or coughing or has a fever, we should distance ourselves from them.
So should I consider you as a suspect? I mean, keeping the 1 meter distance. Knowing you as my sister, what should be my
Yeah, this is not about sister or about a
my
close
relative
relative.
is coming and should I just
I told,
entertain?
yeah, I told you your way of life has changed.
Mm-hmm.
So usually when you see your aunt or friend coming, you will go and run to them, hug them, shake their hands.
Mm-hmm.
But now you are living a different life now. Your way of life has changed. So therefore you can now hug, you can now shake hands, you should stay away from sick. Normally when our children or somebody sick, we'll be rushing to them or so. So we need to have it in mind. If you are turning to somebody who is sick, you should have it in mind, COVID. COVID. When COVID is in your mind, then you will follow everything keenly. So it means that if you have touched somebody who is, if you have come in contact with somebody who has had fever, cough, or is sneezing, and then after a while you say you start falling sick, it should ring a bell in your mind to seek help. You need to seek help by calling the number 4455 to come to your aid. We should not do it like Ebola when we said, this is my old sickness. In fact, I'm always having this running stomach. We should not turn it around and say, I'm always having cold and I'm always having cough and let things to go out of hand. We should seek help as early as we can.
Thank you. Yes, before we leave, we have about 7 more minutes. What should be our number one priority considering our capacity, Dr. Sam? Considering the limited capacity as a country and people, maybe enforcing those stringent measures as we see in other countries. We are lacking those capacity. What should be
So,
our priority now?
so I think our priority should be observing the precautionary measures because of our limited capacity as a country. Put in place the policies that will help make Liberians to decide, make that decision of preventing the disease, especially when it comes to what Mrs. Kerkulah said from the beginning with that of the market. It is one of the main issues right now. We have closed schools, we've closed churches, we've closed malls, we've closed everywhere. Apart from the market that is the same places we go every day, you have the entire place so crowded. I think it's possible for a policy to be put into place where you have maybe about 5 person that is selling the same commodity. You can take 2 person for that day, and then another person that is selling another commodity, and then you divide them in a way that will have to sell according to days. And I think that would be a good one instead of the entire place being crowded up. And even when you go in the market this time, for me, although I'm not supposed to be wearing masks, I have to wear masks because the place is so crowded. I have to get food, but still I have to go there. The other day, it was just they go on Saturday when I went to the market. There was a lady that said, man, excuse ya, you're already protected. You're having it in your face already, auto pass. The place is so packed that everybody is laughing when they see you with it. It's like, it's funny. But the thing about it is that we have to wash hands regularly. That social distancing is number one. After washing your hands, you have to really distance yourself from people. That's the only way. Because if this thing, the number of cases increases, we'll actually have a serious problem in Liberia. Thank you.
Madam Kerkulah, what should be our number one priority considering our capacity, the limited capacity we have as a country and as a nation?
Our number one priority should be prevention. Dr. Sim said it. Prevention, prevention, prevention. Prevention is the opportunity we have. WHO has said over and over again that this disease can be prevented if we follow the preventive measures. So we have a strength. If we prevent ourselves from this disease, then we can live a happy life again. We can return to our activities of daily living in a peaceful manner again.
Okay, we would like to open the line just for the remaining 5 minutes. If the audience have any question, the numbers to call are 0776 865 974, 0776 865 974, or hello? Yes, you're welcome to the Voice of Biblical Fundamentalism. Thank you for your input. Anybody? Okay.
So again, you can speak towards the mask issue.
Yes.
Yeah, so for our
Okay, someone. Hello. Welcome to the Voice of Biblical Fundamentalism. Mrs. Joa, welcome.
Yes, I just want to thank God for my two doctors in that studio there. They are doing well. And I learned a lot from them this morning. I want to thank God for them.
Amen.
Thank you so much. We are proud of you people.
Amen.
And we hope that God will save all our doctors
Amen.
in our church and our
Amen.
nurses.
Amen.
We pray for you people. We pray for you people. Thank you so much.
Amen.
Amen.
Okay. Wow. Do you want to speak to the mass? We have less than 2 minutes.
yes, as for the mask issue, normally we should be, according to WHO, we should only wear masks. For those of us that are health workers, we are allowed to use masks in the hospital and all that. And then you are required to wear masks when you are taking care of somebody that have some symptoms, the respiratory symptoms. And then also, when you yourself is also experiencing those symptoms, there's coughing and sneezing and all that. But usually we are not to be wearing masks actually all over the place. That's the reason why the first thing we talk about is social distancing. If the distance is being maintained, you and only you will be able to prevent it without actually contacting the disease. But if, for example, the cases of the market, if you are going some area that's very crowded and you know the social distancing cannot be maintained, that's the only time at least you can wear a mask. And after that, you come and try to remove it and then discard of the mask. But we are not to actually be wearing masks all over the place.
Hello? Yeah, welcome.
Hello?
Yeah, welcome to the Voice of Biblical Fundamentalism.
Yeah, I've been following this program. Getting me?
Yes, we are getting you. Speak.
Yeah, Judah Monk Davis. I'm calling from CO, the Center for a Change of Intellectual Opinion.
Uh-huh.
I have a concern.
Yes.
Yeah, my concern has to do with the disadvantage you or the one I refer to as the Zocos.
Mm-hmm.
Are you getting me?
Yes, we
Yeah.
are getting you.
Yeah, I'm asking whether you were getting me.
Yeah.
Yes, we are getting you loud and clear.
Oh, okay. So my concern has to do with the disadvantage of the one called Zocos. These guys, they don't touch water. The only water that they touch, that the one they drink.
Okay, thank you. That Madam Kerkulah, how could you? Yeah. Could we address
I don't know why you ready.
how to address that? Madam Kerkulah, in your last meeting, how could you address that and the issue with the social distancing in the marketplace also? Maybe how do you restrict buyers apart from sellers now, buyers, people that go to the market? How do you restrict them to compare them to have the distance that is necessary? And what could be your final word on this whole COVID-19 pandemic?
Okay, firstly, let me let me speak on the market first. The standard operating procedure or the standard or whatever was put in place regarding the market, the government has said there will be a specific strategy that will be put in place for market. And obviously, when there's a specific strategy, there will be enforcement of the strategy. So we know when it comes to pandemic, it's multi-sectoral approach. So the joint security will have that part to play in regulating people entering the market. So to come into the disenfranchised youth or the Zogos, as we commonly call them, the preventive measure is inclusive. It's not restricted to only other people, but it's inclusive. So it applies to the Zogos too. So there should be a means to follow up with them. They should have people working with them closely because they are at risk population. We say WHO has said that smoking reduces your lungs capacity, and this disease is a respiratory tract disease. So therefore, there should be a team or group set up to work with them closely, to follow them up, to know whether they are following the preventive measures that should be done. Because they say no, leave no one behind. The UN policy said leave no one behind and do no harm. So according to that, there should be a policy in place for them to work with them closely. And then my final saying regarding COVID-19, we as Liberians, we have the opportunity, we have the strength to prevent the COVID-19 disease. If only we decide to wash our hands regularly, we, we observe the social distancing rule, we stay away from those that are sick, and if we are sick, we stay away from others. We call the number 4455 for help, and then we continue to spread the message in our household and communities regarding COVID-19.
Thank you, Madam Kerkulah. Dr. Sam, your final word.
So we say thank you to our listeners out there. Our main aim is prevention. So continue to wash your hands, observe social distancing for now, spread the news that COVID-19 is real and it kills. Thank you.
I want to thank you all for listening to us at Fabric 101, the voice of biblical fundamentalism. Come back next Sunday, 8 o'clock a.m., where we'll be discussing the biblical deduction. What does the Bible say about diseases and sickness? And we'll have Pastor Joa with us. We want to thank you, our guest, Madam Kerkulah and Dr. Sam, for honoring our invitation. We want to thank you out there for listening to us, and welcome to the voice of biblical fundamentalism as we observe COVID-19. You are not welcome this time around to Refuge Baptist Church, but listen to us on air via this medium. We are always here on Sunday, 8 o'clock a.m. at Fabric. Amen and amen.
Amen.
Thank you very much. Yeah.
I told me the woman. She said, I have fever. Everybody.